The flu, short for influenza, is a contagious respiratory illness caused by influenza viruses. It infects the nose, throat, and sometimes the lungs. The flu can cause mild to severe illness, and at times it can lead to death. Every year, millions get the flu, hundreds of thousands are hospitalized, and thousands die from flu-related causes. Certain groups are more vulnerable to severe flu complications, including older adults, young children, pregnant women, and people with chronic health conditions like asthma, diabetes, or heart disease. The flu can also impact healthy individuals, but the risk of complications is higher for those in vulnerable groups. Understanding the flu and how to protect yourself is crucial, especially during the flu season. The flu spreads mainly by droplets made when people with flu cough, sneeze, or talk. These droplets can land in the mouths or noses of people who are nearby. Less often, a person might get the flu by touching a surface with the virus and then touching their own mouth, nose, or eyes. Preventive measures can significantly reduce the risk of catching or spreading the flu. Flu symptoms often come on suddenly. People who have the flu often feel some or all of these symptoms: fever or feeling feverish chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, and fatigue or tiredness. Some people may have vomiting and diarrhea, though this is more common in children than adults. Fever is a common flu symptom, but not everyone with the flu will have a fever. Chills often accompany fever and can make a person feel very uncomfortable. Muscle or body aches are another hallmark of the flu, causing a general sense of weakness and pain throughout the body. Fatigue can be extreme with the flu, making it difficult to do everyday activities. Sore throats and coughs are also prevalent, contributing to the overall discomfort. The runny or stuffy nose, while common, can sometimes be mistaken for a cold, but the sudden onset and intensity of symptoms help differentiate the flu. While both the flu and COVID-19 are contagious respiratory illnesses, they are caused by different viruses. COVID-19 is caused by the novel coronavirus SARS-CoV-2, whereas the flu is caused by influenza viruses. Both illnesses have some similar symptoms like fever, cough, and fatigue, but there are key differences. One significant difference is the loss of taste or smell, which is more common in COVID-19 but can sometimes occur with the flu. COVID-19 tends to have a longer incubation period, meaning symptoms appear more slowly after exposure. Breathing issues can be more severe in COVID-19, leading to complications like pneumonia and acute respiratory distress syndrome, or ARDS. The severity of COVID-19 can also be more unpredictable, leading to severe complications in healthy individuals. Additionally, COVID-19 has unique symptoms like COVID toes, a condition affecting the skin, which are not seen with the flu. Understanding these differences helps in seeking appropriate treatment and taking preventive measures. Section 4. Treating flu symptoms. Treating flu symptoms primarily involves supportive care to relieve symptoms and avoid complications. Rest is crucial. Staying in bed helps the body fight off the virus. Hydration is essential, so drink plenty of fluids like water, herbal teas, and broths to stay hydrated and help thin mucus. Over-the-counter fever and pain relievers such as acetaminophen, also known as Tylenol, or ibuprofen, also known as Advil, can help reduce fever and alleviate muscle aches and headaches. Using a humidifier can add moisture to the air, which can ease breathing and help soothe a sore throat and dry cough. Cough medicines can provide temporary relief from persistent coughing, but they should be used cautiously, especially in children. Antiviral medications can shorten the duration of the flu and prevent serious complications if taken early in the infection. It's also essential to stay isolated to prevent spreading the flu to others, particularly vulnerable groups. Section 5. When to seek medical attention. While most people recover from the flu without needing medical care, some symptoms require immediate attention. These include difficulty breathing or shortness of breath, chest pain or pressure, sudden dizziness, confusion, severe or persistent vomiting, and symptoms that improve but then return with fever and worse cough. High-risk groups should be especially vigilant. Older adults, young children, pregnant women, and individuals with chronic health conditions should seek medical advice promptly if they experience flu symptoms. Early treatment can prevent severe complications and improve outcomes. It's also essential to seek medical attention if you have a pre-existing condition that could be worsened by the flu, such as asthma, diabetes, or heart disease. Quick response to severe symptoms can make a critical difference in recovery. Section 6. Preventing the flu. Preventing the flu starts with getting an annual flu vaccination. The flu vaccine is the most effective way to protect yourself and others. Good hygiene practices are also vital. Wash your hands frequently with soap and water. Use an alcohol-based hand sanitizer if soap and water are not available. Cover your mouth and nose with a tissue or your elbow when you cough or sneeze. By taking these measures, you can protect yourself and your community during the flu season. MD Searchlight. Be your own advocate.